Hello, my name is Kelley Thomas, and this discussion is about Turner syndrome. Turner syndrome is a genetic disorder that affects multiple aspects of development in females. There are two types of Turner syndrome. One is classic Turner syndrome. That is where one X chromosome is completely missing. The second is mosaic Turner syndrome, where abnormalities of the X chromosome occur in some of the body's cells but not all of the cells. However, most females with Turner syndrome are missing the second sex chromosome in all of their cells. This results from a random error in an egg or sperm cell prior to conception. Clinical manifestations of Turner syndrome include, but are not limited to, short stature, webbed neck, skeletal anomalies, ovarian failure, cardiovascular disease, renal abnormalities, osteoporosis, autoimmune disorders, diabetes, lymphedema in hands and feet, and lack of a pubertal growth spurt. The role of the nurse in identifying Turner syndrome can start even before birth. Fetal ultrasounds can identify abnormal kidneys and heart abnormalities, just as an example. Nurses can visually identify some signs and symptoms of Turner syndrome with the first assessment right after birth. Some of the signs visually present at birth include, but are not limited to, webbed neck, low ears, a broad chest, arms that turn out at the elbow, and short fingers and/or toes. A nurse will also have a role in continued treatment and medical intervention during years. Actually, all of the years of her life. As these girls grow, there are greater opportunities for nursing interventions. These interventions include helping to improve self-esteem, assisting girls to find support groups with other girls with the same condition, and by encouraging them to get involved in their own medical care and treatment. To help these girls with self-esteem issues, nurses should help them explore their thoughts, feelings, and emotions about having this syndrome and how it has affected their individual being, their relationships with their family members, and relationships with outside members in their social circles. By helping to identify and then later expressing these feelings and emotions, these nurses can actually help to improve the overall health of the individual person. Going on further to talk about support groups, it is very important that these young ladies realize that they are not alone and that their mental health, as well as their physical health, is what is important to their success in life. Some basic care and safety issues to consider are taking medications as prescribed, the need for calcium and vitamin D supplements, exercise, and seeing specialty physicians. Statistically speaking, Turner syndrome is the most common sex chromosome abnormality in females and occurs in approximately 1 in 2,000 to 1 in 2,500 live female births. Based on epidemiological and newborn genetic screening data from Europe, Japan, and the United States. Again, Turner syndrome is caused by a random error in the formation of an egg or sperm cell. It is not an inherited genetic disorder. Because it is not inherited, it is unlikely that parents of a daughter with Turner syndrome will have another daughter with it. The risk for Turner syndrome is the same for all females, no matter her race, ethnic background, economic status, or environment. It is also not associated with parental age. There are no known toxins or environmental factors that actually influence the risk. Treatment considerations. A quick reminder: managing an issue helps to decrease that issue. Growth hormones are given due to short stature. A well-balanced diet should always be maintained. Supplements should be given. Regularly scheduled appointments with all specialists should be kept. Medications should be taken as prescribed. Infertility treatments should be sought if the adult woman is interested in childbearing, and again, support groups should be utilized for the overall health of the patient. Given that this genetic disorder does not discriminate among races, cultural differences should be examined in order to help the patient in the most effective and well-rounded way possible. One area could be religious objection to certain medications. Another area, one that we will explore, is that a nurse can make a direct impact in the nutritional arena. Different cultures have varying dietary restrictions due to the importance of a girl remaining at a certain weight and/or maintaining her weight and being fortified nutritionally. Each individual patient can have daily meal plans developed that will consider all specific dietary necessities that also takes into account all dietary restrictions. As an example, there is a high probability of an Indian girl living in India being a vegetarian or a vegan, so appropriate meal plans for a well-balanced diet can be developed with the nurse's help. In summary, Turner syndrome is a genetic disorder that affects multiple aspects of development in females, and females only. All females can be affected, as there's equal risk. One very problematic issue for these girls has to deal with height, and that is why these children are given growth hormones. Many people debate giving these hormones. Some feel that it helps the girl with the psychosocial aspect of the disorder, while others feel that gaining height isn't worth the risk of giving growth hormones. The infertility issue is another big issue with this syndrome. Ovarian failure leaves these girls infertile. Maternal egg donation and cryopreservation for a daughter with Turner syndrome is an option and has been discussed. This creates an ethical issue since the egg donor would be the biological parent of her grandchild. However, this option does allow girls with Turner syndrome a chance to have a child, and a child that is also genetically linked to her. Even though Turner syndrome is the most common sex chromosome disorder in girls, it is not widely known about. Nurses play a significant role because they are there for the child before birth, to after delivery, to the formative and adolescent years, to the child rearing years, and even beyond. Nurses can educate family members and then the patient when she gets old enough. Nurses can lead these girls and can have an all-encompassing positive effect on the girls affected with this syndrome.